Welcome to another episode from the Veterinary Research Channel. Today, Ava and I are diving into some fascinating research concerning our short-nosed furry friends, specifically pugs and French bulldogs.
That's right, Stefan. These breeds, while undeniably adorable, are known for their breathing difficulties, often grouped under the umbrella term Brachycephalic syndrome. Today's paper, from Veterinary Surgery in 2023, investigates a method used to assess one aspect of the syndrome, the dynamic collapse of the nasopharynx.
For our listeners who might not be familiar, the nasopharynx is essentially the upper part of the throat, behind the nasal cavity. The researchers, Vodnarek and colleagues at the University of Veterinary Medicine Vienna, focused on how this area changes during breathing in pugs and French bulldogs.
Exactly. The paper highlights that dynamic nasopharyngeal collapse, which is the partial or complete blockage of this airway during breathing, is considered a significant contributor to brachycephalic syndrome. It occurs due to the soft palate moving upwards or the pharyngeal wall moving downwards during inhalation.
The traditional way to diagnose and assess the severity of this collapse has often relied on visually estimating how much the nasopharyngeal opening is reduced during fluoroscopy, which is a kind of moving X-ray. The paper points out that this visual estimation can be subjective, and there hasn't been much research into how consistent these estimations are between different observers or even the same observer at different times.
And that's crucial, isn't it, Stefan? If we want to objectively understand nasopharyngeal collapse and evaluate the effectiveness of any surgical treatments, we need reliable and consistent methods of assessment. This study aimed to address this gap by comparing how well different observers agreed on measurements of nasopharyngeal dimensions during breathing using fluoroscopy in these breeds.
The researchers explored two different ways of taking these measurements. The first they called the functional method. In this approach, observers identified the point of maximal narrowing in the nasopharynx during inhalation and then measured the height of the opening at that specific location during both inhalation and exhalation.
The second method was termed the anatomically adjusted method. Here, measurements were taken at the level of the tip of the epiglottis, that little flap of cartilage in the throat, and the minimal and maximal heights of the airway were measured at this consistent anatomical landmark during the breathing cycle.
They hypothesized that these techniques could offer good consistency among different observers, regardless of their experience level, and that they would be reliable tools for evaluating nasopharyngeal collapse. They even thought the anatomically adjusted method might be more consistent.
To test this, they used fluoroscopy videos of 20 French bulldogs and 16 pugs that had been referred for brachycephalic airway syndrome. For observers with varying levels of experience, including a radiology specialist, a surgery specialist, a surgery intern, and a radiology resident, independently analyzed these videos.
Each observer measured the nasopharyngeal dimensions at the points defined by both methods during inhalation and exhalation. They did this twice, about a month apart, without knowing they were looking at the same videos again. This helped the researchers assess both how consistent each observer was with their own measurements, and how much the different observers agreed with each other.
Once all the measurements were collected, the researchers calculated the change in nasopharyngeal dimensions during breathing and also assigned a grade of collapse, no collapse, partial collapse, or complete collapse, based on the degree of narrowing. Then came the statistical analysis to see how reliable and consistent these measurements and grades were.
So, Ava, what did they find? Were these methods as reliable as they had hoped?
Well, Stefan, the results provide some interesting insights. When looking at the maximal dimension of the nasopharynx during exhalation, both the functional and anatomically adjusted methods showed good consistency both within the same observer and between different observers.
That's a positive start, at least for the maximal opening. What about the minimal dimension, the point of greatest narrowing during inhalation?
For the minimal dimension, the functional method showed good consistency within the same observer, but only moderate consistency between different observers. Interestingly, the anatomically adjusted method showed moderate consistency within the same observer, but good consistency between different observers.
That's a bit of a mixed bag then. It seems the choice of method might influence whether consistency is better within an individual or between different people.
Precisely. The researchers also looked at the ratio of the change in nasopharyngeal dimensions, which they called delta L. For this measure, the functional method demonstrated good consistency within the same observer and moderate consistency between different observers. The anatomically adjusted method showed moderate consistency for both within and between observers.
And what about the grading of the nasopharyngeal collapse? No, partial, or complete? That seems like a very clinically relevant assessment.
For the collapse grading, both methods showed moderate consistency within the same observer. However, the consistency between different observers was fair for the functional method and moderate for the anatomically adjusted method.
So, overall, it seems there was some variability in the measurements and the grading of nasopharyngeal collapse, regardless of the method used.
That's a key takeaway. However, there was one observer, a specialist in veterinary diagnostic imaging, who consistently achieved excellent consistency in their own measurements for both methods and very good to good consistency in grading the collapse. This suggests that experience and training in image interpretation might play a significant role in the reliability of these assessments.
That makes sense. Someone who looks at these kinds of images regularly is likely to be more attuned to subtle differences and consistent in their approach.
The researchers also discussed some of the potential reasons for the observed variability. For example, it can be challenging for observers to precisely place their measurement markers on the screen. They might also have differing interpretations of what constitutes the point of maximal narrowing or whether a collapse is truly complete or just very severe.
And the dynamic nature of breathing itself must add another layer of complexity. The exact point of maximal narrowing might vary slightly between different breaths.
Exactly. The study design involved observers choosing the breathing cycle with the most severe narrowing. The researchers acknowledged that there might be variability in nasopharyngeal dimensions between different breathing cycles in the same animal, although this hasn't been formally studied. They suggest that future research could explore the minimal, maximal, and average changes in these dimensions.
It's also important to remember the limitations of the study itself. All the fluoroscopic examinations were done with the dogs in lateral recumbency, lying on their side. The researchers point out that this position might increase stress in these already breathing-compromised dogs, potentially affecting the results. Ideally, assessments in a more natural standing or sternal position would be valuable, but the equipment available at the time of the study didn't allow for this.
Despite these limitations, the study provides valuable initial data on the reliability of these fluoroscopic measurement techniques for assessing nasopharyngeal collapse in brachycephalic dogs. The finding that an experienced radiologist achieved much higher consistency highlights the potential for training and expertise to improve the reliability of these methods.
The researchers also made an interesting point about using the continuous ratio of dynamic change, delta L, rather than the more categorical grades of collapse. They suggest that using a continuous measure avoids introducing arbitrary cutoffs that might not perfectly reflect the clinical reality. For example, a dog with a delta L of 0.49 and one with 0.51 would fall into different collapse grades, even though their actual degree of narrowing might be very similar. They found that the delta L measure showed marginally better overall consistency compared to the grading system.
Ultimately, the study concludes that while these two-dimensional fluoroscopic measurements of nasopharyngeal dimension changes do show considerable variability, particularly among less experienced observers, they can potentially be more reliable in the hands of trained specialists. They emphasize the need for further studies, especially those comparing agreement among imaging specialists, to determine which method offers the best consistency and clinical utility.
This research underscores the challenges in objectively assessing dynamic airway conditions like nasopharyngeal collapse. It highlights the importance of careful methodology, standardized training, and potentially a move towards more continuous measures in clinical practice and future research. It also reminds us that while technology like fluoroscopy provides valuable insights, the expertise of the observer remains a critical factor in obtaining reliable and meaningful information.
Definitely, Stefan. Understanding the reliability of these diagnostic tools is fundamental to improving our ability to diagnose and manage brachycephalic airway syndrome in these beloved breeds. The call for further research into the impact of nasopharyngeal collapse on respiration and the effects of surgery on this condition is also crucial for advancing our knowledge and improving patient outcomes.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.